All right, heart health is a big issue for many people, especially this morning during Heart Awareness Month. Heart disease is the leading cause of death in this country, killing someone every 84 seconds, and exercise is crucial for prevention. But a new Cleveland Clinic survey shows 40% of Americans are getting less than the recommended amount. Our Dr. Tara Narula is a cardiologist at Lenox Hill Hospital in New York. Good morning, and I see you have on your red as well.
Yes.
For
Heart Day, yeah.
That's
Heart
right.
Health Day.
So this, I think, is really important. What is the right amount of exercise that we should be doing?
Exactly. And this survey showed 20% of Americans know the right amount for heart health. The rest don't. So it's important to understand that the goals are 150 minutes a week of moderate intensity aerobic exercise or 75 minutes a week of vigorous intensity aerobic exercise. If you want additional benefits, you can throw in some strength and resistance training 2 days a week. It doesn't have to be done all at once. You can break up that into, let's say 30 minutes 5 days a week, 10-minute intervals, but it's important to make it a priority and fit it in because exercise lowers blood pressure, improves cholesterol, blood sugar management, decreases inflammation. It's just generally wonderful for the body.
And just to sort of do the math, I guess the way to think about it is try and do at least 30 minutes of exercise a day.
5 days a week would be 150 minutes, yeah. And if
that seems easier when you break it down that way, Nora.
Right.
But aren't you upping the ante? Aren't doctors upping the ante on how much exercise we have to do? Because I've always heard do 8 strong minutes a day and you'll be okay.
These have been the recommendations, at least by the American Heart Association, for a while. So this is what we always counsel our patients about. Yes.
You're only the 80% that don't know the right amount.
Okay. But everybody has excuses about not doing it.
They do.
Everybody does.
And this, I've heard them all. And this survey showed that 41%.
I'll give you mine.
41% of people said that it was work obligations. 37% blamed being too tired. 28% said that they had family and friend obligations, and 14% said they were just too out of shape.
Who has better excuses, men or women?
I think they both. They both have pretty good excuses, unfortunately. But a lot of people wonder, how much do I really have to push myself? You got to push yourself till you're a little out of breath, you're fatigued. And if you want to have a goal heart rate, you can take 220, subtract your age, and take 65% to 85% of that and shoot for that range.
So it's more than just losing weight. It really is. It's all about your health.
Absolutely.
Both my parents died of heart attacks, so I know that this is very, very important information.
Yes, and losing weight is much more diet than it is exercise. 70%
And it's important
diet.
to know, even if you have heart disease, it's still important to exercise.
Absolutely. Even if you have heart disease, you should be exercising the same amount.
All right, Dr. Tara Narula, thanks so much.